Channel 3 News in HD starts now.
It's an issue that affects thousands of men, male pattern baldness. While there's no cure, there are options from drugs to hair pieces to actually fixing the problem with surgery. It's not cheap, but for some, it's the answer. Health anchor Monica Robbins shows us how it's done.
4 years ago, Ron Tucholsky made a change.
I had a choice in my life to either buy a brand new car or save up for a hair transplant, and I chose a hair transplant, and I never regretted it.
Cost depends on how much hair you need. Fees start at $2,500 in Dr. Robert Haber's office. Often you're paying for experience and talent.
The best investment I ever made in my life.
Why?
Because it was something I did for myself.
You just can't tell that any surgery was done. We try to match a transplanted hairline to be as similar to a natural, original hairline as possible.
New natural hairlines start by harvesting donor tissue from the back of the head. A strip of tissue about 3 inches long with several healthy hair follicles intact is removed. This is the most difficult part of the procedure. So Dr. Haber invented a spreading device that makes it easier to remove and preserve the donor follicles. It's now used around the world. While the wound is being stitched up, medical technicians are painstakingly removing each hair follicle from the strip that's been slivered. Each one contains 5 to 10 follicles. To some, curing baldness may seem vain, but there may be a health benefit too.
90% of Dr. Haber's clients also use the preventative hair loss drug Propecia. Not only does it help them hold on to the hair that they have, recent studies show another form of the drug may even help prevent prostate cancer.
Back in surgery, Dr. Haber implants each follicle sporadically so the hairline isn't obvious. The follicle stays intact, but the implanted hair will fall out, so it will be months before Ron sees a difference.
It takes a while. It's hair, so it has to grow.
Well, Dr. Haber recommends really doing your homework before choosing a hair transplant, doctor. And as you can tell, it does make a difference if you want to spend the money. Now, make sure the person you choose is experienced and ask for references. Clinical studies have shown that hair loss can cause low self-esteem in men, but about 70% of men and 50% of women will experience some degree of hair loss. Causes are usually from genes, hormones, and age. Ramona?
All right, that will be helpful to a lot of people. Thanks, Monica.